So how many times do you think it's normal to wake up at night and go to the bathroom? Is it 1? Is it 2? Is it 3? Is it normal when you get older? Is it normal when you are stressed out or other things? To be honest with you, most people kind of get it wrong because everyone assumes the ideal number is 0. And yes, even myself, I would love to never wake up at night and go pee. But there are certain factors in your health where you may wake up at night to urinate, and it's not always a problem. So as we get older, waking up at night becomes a little bit more common. In your 60s and 70s, maybe twice a night. In your 70s, maybe 3 to 4 times a night. And honestly, a lot of it doesn't even have to do with your bladder. It could be your sleep cycles changing. It could be back pain. It could be what you've eaten. So 0 is nice to get, but that's not what we should aim for. But what we really want to do is figure out why it's happening and how much of it is flexible and how much of it requires you to come see someone like me. Hey, what's up everybody? I'm Dr. Jamin Brahmbhatt, or Dr. B as most of my patients call me. I'm a urologist and robotic surgeon here in Orlando, and I've been helping patients for the last 19 years while also sharing health education through TEDx talks and international media. And today, we're gonna talk about why you keep waking up in the middle of the night to pee. And while most people just write it off as getting older, it can actually be telling you something important about your health. And sometimes it's a simple fix, and sometimes it's a warning sign for something even bigger. So stick to the end so you know when it's actually time to see a doctor versus something that's normal based on your overall health or your age. So let's get into it. So let me tell you about what happened to me last year. I've been sleeping fine for years, and all of a sudden, I started waking up 2 to 3 times a night. It just came out of nowhere. I tried my best to just stay asleep, and I tried myself to just force not to go to the bathroom, but I had to go to the bathroom. And this truly did happen all of a sudden. So I started thinking, I'm a urologist. Like, is there something wrong with me? I'm only in my 40s. Do I have to go get an evaluation? Should I go get my bladder scan? Should I go see one of my buddies that's a urologist? Should I try to scope myself? I went down this deep dark tunnel because I was like, this is not normal. What's going on with me? And then I realized I had this epiphany. Something did change in my life recently. I wanted to try a tea to help me sleep better at night. The tea actually said it's to relax you before you go to bed. And it was some tea that had chamomile and some valerian root and all the stuff that's supposed to help you wind down. So I bought it on Amazon, started using it, and turns out it didn't really relax me. It actually made me wake up more at night to go urinate. And this is because certain teas, even though they're labeled to help you sleep, can be mild diuretics. They push more fluid through your system, so your kidneys making more urine. And then when it enters your urine, it goes into your bladder. Well, guess what? You're making more urine. So then you're gonna have to go to the bathroom more. Or some of these teas can also irritate your bladder, some of the things inside of the teas, which then again, make you wanna go to the bathroom more. So the very thing I thought was gonna help me sleep, well, guess what? It didn't. It actually made me wake up more at night. So sometimes figuring out why certain things are changing in your health are as simple as that. What change have you made? And then you kind of figure it out. Just like I did with the sleep tea that I used to take. I don't take it anymore. And now my sleep is back to normal. So now let's take a look at all the different reasons your bladder may be kind of signaling to you or yelling at you in the middle of the night. So if you look at the true definition of nocturia in all of our medical books, even when you wake up at 1 time a night, it's labeled as nocturia. But in real life, most of us don't worry about it until it's 2 or 3 or something consistent or causing us to be super duper tired in the morning. And here's the thing, the number itself matters less than whether it's changing. If you used to sleep through the night and now you're waking up twice, that's probably worth paying attention to. But if now you're waking up at night 2-3 times a day and it's happening all the time and it's more urgent, then maybe you need an evaluation. So let's start off with the most common reason most of us are probably waking up in the middle of the night. And this is probably something you don't even think about. It's probably what you've eaten or had to drink before you go to bed. Caffeine is an obvious one. That afternoon espresso or that evening tea, even sodas. Like let's say you're having a soda with your pizza. All these things have caffeine, and caffeine is a diuretic. But not only that, all of these things are also made with a lot of water in them. So you're increasing your fluid intake, you're adding a diuretic, and boom, you're making more urine, which is gonna make you wake up at night more urinate. So next time you're having that 4 o'clock coffee, waking up at night, well, that could be a problem. Or if you're having that tea at night to help you sleep better like I did, and you're waking up at night, it's probably the thing that you're drinking before you go to sleep. So another big cause of waking up in the middle of the night could be the alcohol that you've had. A glass of wine with dinner may feel like the perfect way to wind down, but alcohol is a diuretic too. It pulls fluid out of your body, and on top of that, the alcohol itself can disrupt your sleep cycles. And so you wake up more easily and notice that the bladder is signaling you to go to the bathroom. And then there's the big surprise category, which we already talked about. Herbal teas, even some of those sleep blends, they can be mild diuretics. And literally, that's what happened to me. I know I've said this 17 times already. Those teas can cause you to wake up at night to urinate. And here's another one that people often don't think of. It's actually water-heavy foods like watermelon, cucumbers, celery, oranges, grapes. So that fruit bowl before you're going to sleep at night may sound, in theory, like it's super duper healthy, but you may be loading up your bladder, and hours later your fluid is pumping through your bladder and your kidneys, and then you have to wake up at night to pee. So what's the fix for all this? If you're gonna come see me in the office, this is what we're usually gonna recommend. Try cutting off fluids about 2 to 3 hours before you go to bed. Also, watch what you eat in those last few hours. And if you suspect it's a specific drink, like that glass of wine or the tea, try skipping it for a week and see what happens. Sometimes doing something simple like a bladder diary, where you jot down what you've eaten, what you've drank, how many times you've gotten up at night, can help you identify the culprit pretty quickly. And if you don't do it on your own, if you come see me, I'll probably ask you to do a bladder diary. So why not do it on your own? Reason number 2, hormones. Here's something most people don't know. Your body actually produces a hormone called antidiuretic hormone, or ADH. Its whole job is to tell your kidneys, hey, it's night, time to go to bed, stop making urine. It's kind of the reason healthy young people can go 8 hours without peeing. And as you get older, your body actually starts making less of this ADH stuff. So your kidneys keep making urine through the night, even while you're trying to sleep. And that's why nocturia, where you're waking up at night to urinate, gets more common as we age. For women, menopause adds another layer. Lower estrogen levels can change your bladder capacity. It can cause dryness around the vaginal area, which then can cause dryness around the urethra. When you've gone through menopause, you can get a change in your pelvic floor. All of these, when they come together, may lead you to have changes in the way you pee. And one of those changes could be a change in the irritative symptoms you're having, which then can lead to urges and then can lead to you waking up at night to urinate. For men, hormones drive prostate growth as you age. This is something called benign prostatic hyperplasia, or BPH. The prostate sits right in front of the bladder. And as we get older, the prostate grows. And as the prostate grows, that channel that you urinate through actually gets narrower. So what happens? Your bladder has to work a little bit extra harder. When it has to work harder and go against that prostate, then there's going to be some things that get off sync. And some of the changes men may have because of an enlarged prostate could not only be a weak stream, having to push to go, having to kind of wait, maybe having some dribbling, but they can also have what we call irritative symptoms, where they may have overactive bladder, they may have nocturia, where they're waking up at night to go to the bathroom. All of these can be signs of enlarged prostate. So here's the punchline. You finish peeing, but you didn't actually empty. So what happens to these guys sometimes is that they just don't empty their bladder. And so they always have something called urinary retention. So there's always the tank like never empties, and it's always a little full. So when you make more urine, it's essentially kind of getting signals to your brain that, oh my God, the bladder's full, bladder's full. So because the tank is always half full, it's leading you to get these signals much quicker than you actually want. And then in this specific case where we're talking about nocturia, you're waking up at night to urinate at 2 a.m. when you want to be sleeping. Now the best thing is, if you're a woman who's having these symptoms because you're postmenopausal, there's actually great treatments that we can recommend. One of those I can think of right now is vaginal estrogen therapy. For men, if we think the issue is because of an enlarged prostate, there's some great treatments we can do with saw palmetto supplements, medications that relax your prostate or shrink your prostate, or even surgeries that we can do to open up your prostate channel. But before we recommend medical therapy or surgical treatments or procedures, we're always going to look at your lifestyles first. And this is where we go back to, is it something else beyond urology that's causing you to wake up at night to pee? Reason number 3, it could be something bigger. And this is one I really want you to pay attention to. Nocturia sometimes can be a warning sign for something bigger. High blood pressure can cause fluids to be off balance, especially at night, which means your body's producing more urine while you're asleep. Diabetes is also a huge one. When your sugar is super duper high, your kidneys flush the excess sugar through your urine, and this means you're gonna have more trips to the bathroom, whether it's during the day or also at night. You'd be surprised how many patients I've seen where they're waking up at night to pee, they come see me asking for medicine, and their real problem is that their A1C, which is a marker of diabetes, is out the roof. So their real problem has nothing to do with their bladder or their prostate, but it has to do with their diabetes, high sugar levels. So this is more of a medical issue versus a true urologic issue. And then there's sleep apnea. This one's a little sneaky, and honestly, it fascinates me. So here's how it works. When your airway closes while you're sleeping, your chest pulls extra hard to breathe. That pulls extra blood vessels to your heart, and your heart thinks, whoa, I'm overloaded with fluid, so it releases a hormone called ANP and tells your kidneys to dump water and sodium. So what does this all mean? Your heart is literally telling your bladder to fill up. So you're waking up at night thinking, I have to pee, but what actually woke you up was the breathing disruption. So you're getting up multiple times at night, and you also snore loudly and can't let the person next to you sleep. And then during the day, you're feeling exhausted, or you have high blood pressure. In any of these scenarios, you gotta talk to your doctor. Treating sleep apnea, controlling your blood pressure, managing your blood sugars, any of these fixes might solve your nighttime peeing too, but also fixing the sleep apnea, the high blood sugars, or your high blood pressure may also save your life in the future. Reason number 4, your medications. So this one's kind of big, and a lot of people do miss it. The most obvious culprit in your medicine cabinet that could be causing you to pee more at night or even during the day is a class of medications called diuretics, or more commonly referred to as water pills. These are generally prescribed for patients with high blood pressure or other heart conditions. Its whole job is to get extra fluid out of your body through your kidneys, which then means you're making more urine. So then that means and translates into that you're gonna pee more. So if you're taking them first thing in the morning, you're probably gonna have some urinary frequency throughout the day. If you're taking them in the afternoon or evening, well, guess what? You're probably gonna have to wake up at night to urinate because, as I said, you're draining more fluid out of your body, your bladder's getting full more often, which means you're gonna have to wake up at night to pee. So if your nocturia does have something to do with your medication, in this case specifically a diuretic, talk to your doctor. Sometimes there's alternative medicines, sometimes they can adjust what time you take the medicine, but don't do it on your own. Always, always, always run by any changes in your medications with your doctor that's prescribing the medicine first. If you come see me in the office and I think your issue is because of your diuretic, I'm either gonna pick up the phone and talk to your primary care doctor or your cardiologist, or I'm gonna ask you to talk to them so that they can adjust the medicines. So beyond diuretics, there's some other medications that can contribute to this as well. Some are antidepressants, some are sedatives, some are muscle relaxants, some are diabetes medicines, some are calcium channel blockers for high blood pressure. These medicines can affect your bladder function, or they can affect your fluid balance. And all these things can kind of translate into you waking up at night to pee. So take out your list of medicines, look at them. If you're gonna start a new medicine, also see if that medicine all of a sudden is making you urinate at night. If all of these things start changing, then it's probably time to bring it up with the person that prescribed you the medicine or have them refer you to someone like me, and then we'll take a team approach to figuring out how you can stay on the medicine that you need for your medical problem, or also help you wake up less at night to urinate. So reason number 5, the last reason, this one's actually pretty interesting. And sometimes it's not even your bladder waking you up. Sometimes you're waking up anyway, and you just happen to notice that you have to go pee, or you're like, hey, I'm awake, let me just go and empty my bladder. As we get older, we spend less time in deep sleep. Our sleep gets lighter and gets a little bit more fragmented. So any little disturbance, a sound outside, your partner moving, a full bladder can wake you up way more easily than when you were younger, like let's say 25 or 30s. When you were young, your body would just ignore these minor bladder symptoms and signals and keep sleeping. Now, as we're a little bit older, every little signal becomes a wake-up call. So you stumble to the bathroom and you go pee, but the real issue is not your bladder or prostate, but it's actually your overall sleep cycles. Now, you can't change things that happen with age, but there are some things you can do to optimize what you're doing before you go to sleep, and then hopefully you get better sleep. And this is where you would improve your overall sleep hygiene. Keep your bedroom dark, cool, quiet. Stick to a consistent bedroom time. Cut the screens out. So if you're watching this right now and you're in bed and you're supposed to be going to sleep, well, maybe continue watching it, or pause it, turn that screen off, and then watch it tomorrow so that it doesn't affect your sleep. And if you do wake up in the middle of the night, perhaps try to relax a little bit and see if you can avoid getting that urge or having to actually go to the bathroom. Sometimes within a few minutes, the urge will pass and you won't need to get up and go to the bathroom. So when should you actually go and get medical attention? Well, here's where I tell everyone. If you're worried about something, then go get yourself checked out. But there are some things that could just be common for your age. If you're waking up 2 to 3 times a night consistently, if you've been doing this for a few weeks, then perhaps it's probably a good reason to go and get yourself checked out. Especially if any of this applies to you, like you snore at night and your partner is staying awake because of how loud you snore. You're exhausted the next day after you're supposed to be sleeping. You have high blood pressure. You have uncontrolled diabetes, you're gaining weight and you can't exactly explain it why. You're getting thirsty all the time and peeing all throughout the day. You have a weak stream. You have trouble emptying your bladder. If you have any of these, plus nighttime nocturia, or the nighttime urge to pee, which is keeping you awake at night, go see a doctor. And listen, your sleep matters. Like losing 30 to 60 minutes a night for years adds up, and it can affect your mood, your weight, your heart, your brain, and even your sex life. Most nocturia is fixable. Some nocturia is related to age. And then there's other nocturia, which is just common. You don't have to figure out which is normal, which is not. That's why you have your healthcare professionals, whether it's your primary care doctor or your board certified urologist like me. So here's the bottom line. If you're waking up in the middle of the night to pee, don't just write it off as getting older. The cause could be something as simple as your evening tea, like in my case, or it could be your medicines, your hormones, your sleep quality. It could be so many different things. The overall point is, even when you're waking up at night to pee more than you should, your body is talking to you. It's giving you signs and signals. It's telling you, hey, go get yourself checked out. And listen, if there's been something looking or feeling different in your pee, like the color, you may want to check out this video where I break down every color of urine and what it's telling you about your health. And listen, if you got something out of this video, please hit the subscribe button, hit the bell so you don't miss the next one, and drop a comment below. How many times are you getting up at night to pee? I've already told you everything about me. What do you think is causing it for you? I would love to hear from you. And finally, share this video with someone who's been losing sleep over this. It could be your partner, it could be your parent, it could be your best friend. Better sleep can change someone's whole life. And if there's a topic you want me to cover, let me know down below. This is Dr. B. Thank you so much for watching, and I'll see you in the next video.